We investigated, that's a weird question if you like. When we realized that these cells undergo this spontaneous and selective apoptosis when they hit a very inflammatory environment, we wondered whether this is a normal physiological function, because we're not, of course, built to receive these cells. So what we identified is that all these cells in the different tissues undergo this selective cell death simply as a consequence of an inflammatory injury. That could be stroke, could be myocardial infarction, could be anything that induces strong inflammation. So what we found is that these cells, whilst the vast majority of the cells can decide whether to undergo a pro-inflammatory death or an anti-inflammatory death, these cells seem to be selectively built to respond only to produce an anti-inflammatory cell death. So what we found is that their intrinsic molecular signaling is specifically directed towards an immunosuppressive activity. So we believe now that these cells are the gatekeepers or the sentinels of tissue repair, because they smell the presence of these activated cytotoxic cells, and the result of that, they start trying to calm down the over-exuberant immune responses. So these has, of course, implications, because once we will identify which is exactly the right pathway, we can intervene rather with cells with proper drugs to identify, to selectively change the pathway according to what we want.